time is now, which is going to determine the future of the end sector, especially in the US, and as an example, the US to the rest of the world. I think one thing that's very clear is that if you look at what the FDA have done, with all the MDOs that came out at the end of last year, with a perceived change in the regulatory goalposts from the guidance document to what they're actually enforcing. The one thing that's very clear is that FDA are super serious about ensuring that products that are available on the US market are appropriate for the protection of public health. And whilst a lot of ENDS companies see this as a hurdle that they have to overcome in order to get the products on the market, my advice always is to ENDS companies, no matter how large or how small, is that see this as an opportunity, embrace the opportunity to work together with the FDA to meet the required standard, because ultimately, regardless of any political undertones that might be in FDA's decisions, FDA is looking after the health of the population in the US. And a large part of that is to ensure that the product is performing consistently, is scientifically substantiated to be reduced risk compared to combustible cigarettes, and importantly, is not attracting youth and other vulnerable populations. And I think working together with the FDA, putting together the data packages that they want to see in order to be able to prove those 3 points I spoke about can only be a positive thing, not only for ENDS companies, but as I said before, most importantly for smokers who have no alternative but to switch to ENDS because they just can't quit otherwise.